Stop. Before you flush that toilet one more time, you need to see this. What I'm about to show you could be the difference between catching kidney disease early when it's still reversible or discovering it too late when dialysis becomes your only option. I'm Dr. Sarah Mitchell, and in my decades practicing nephrology, I've lost count of how many patients have sat across from me with advanced kidney failure, saying the same heartbreaking words. Doctor, I noticed something strange months ago, but I thought it was just getting older. I wish I'd paid attention sooner. Right now, your kidneys might be screaming a warning at you, and you're flushing the evidence away every single day without even looking. What comes out of your body is literally showing you what's happening inside, months, sometimes years before you'll feel tired, before the swelling starts, before any blood test will detect early damage. And here's what terrifies me most. The deadliest type of urine, the one that signals advanced kidney failure, doesn't always look obviously wrong. Sometimes it's subtle. Sometimes people see it and think, that's a little different, and then forget about it. But here's the truth that gives me hope. If you know what to look for, you have power. You can catch these deadly warning signs early when treatment is simple and kidney function can be preserved at over 90%. Your toilet bowl is literally giving you a free kidney screening every single day, but only if you know how to read the signs. Today, I'm going to show you exactly what you need to see, and more importantly, what you must never ignore. Something as straightforward as color already tells us volumes about your kidney filtration, hydration status, liver function, or whether there's internal bleeding you cannot see or feel. The clarity, foam level, and frequency of urination reveal critical information from diabetes to heart problems to kidney disease. And at the end, I'll give you 3 simple strategies to protect your kidney health. Starting today, to help you understand this clearly, we physicians use what I call the urine color scale. It describes how urine appears, ranging from clear to dark amber to dangerous colors, numbered 1 through 8. I strongly encourage you to print this out and post it in your bathroom. There's no shame in this. It's a medical tool that empowers you to monitor your own health. If your urine looks like level 1, completely clear like pure water, that might seem healthy, but it actually suggests you're drinking too much water too quickly. Your kidneys are working overtime, and you're potentially washing out essential electrolytes. This can cause dizziness, headaches, muscle cramps, and in extreme cases, dangerous sodium imbalances throughout your entire body. At the opposite extreme is level 8, dark brown or tea-colored urine, meaning your kidneys are either severely dehydrated or failing to filter waste properly. Here's what I want you to remember. Ideally, your urine should come out pale yellow, like fresh lemonade, clear without cloudiness, and with minimal odor. When your kidneys filter blood properly, they remove waste while keeping essential proteins and nutrients. That pale yellow comes from a waste product called urochrome, which signals normal kidney function. So that familiar pale yellow actually indicates healthy filtration. Now, here's what I rarely see other doctors explain properly. It's not enough for color to be normal. Frequency matters just as much. Ideally, you should urinate every 3 to 4 hours during the day, producing about 6 to 8 ounces each time. Some people naturally go more or less frequently. And if that's been your lifelong pattern, and you feel completely empty afterward, that can be normal for you. However, when you're suddenly urinating every hour, or when you notice you're barely producing any urine despite drinking normally, that's a red flag demanding attention. Changes in urinary frequency aren't random. They can signal kidney stones, urinary tract infections, diabetes onset, enlarged prostate in men, bladder problems, heart failure affecting fluid balance, or even early kidney disease. Color, clarity, and frequency. These are your 3 essential keys. Now, let's look at specific danger signs. Healthy urine should flow in a steady stream with normal pressure. If your urine is coming out in a weak dribble, stopping and starting, or if you have to strain to begin urinating, that can warn that something is blocking or narrowing the urinary tract. This doesn't automatically mean kidney disease. It could be prostate enlargement in men, bladder muscle weakness, or medication side effects. But it can also indicate serious kidney problems. If you notice repeatedly weak flow or difficulty starting urination, especially if this is a change from normal, see a doctor promptly. When you finish urinating, you should feel complete emptying, that distinct sensation of relief in your lower abdomen. Many people, especially as they age, feel like they need to go again immediately after finishing. We call this incomplete emptying, particularly common in men over 60 and women after menopause. Another concerning symptom is sudden urgent need to urinate throughout the day, even when your bladder isn't full. This is called urgency, and it means your bladder or kidneys aren't functioning properly or are experiencing inflammation. For healthy urination, here's my specific recommendation. Upon waking, drink a full large glass of water before anything else. This helps flush your kidneys. Throughout the day, drink another glass every 1 to 2 hours, stopping about 2 hours before bedtime. Monitor your sodium intake carefully. Limit processed foods, canned soups, and restaurant meals high in hidden salt. I often recommend preparing fresh fruit water with cucumber, lemon, and mint. Drink 1 to 2 glasses daily. If you're urinating more than 10 times per day for more than a week, that's frequent urination requiring thorough investigation. We need to rule out diabetes, urinary tract infections, kidney stones, overactive bladder, or other significant problems. Frequent urination disrupts sleep and daily activities and always has an underlying cause needing treatment. Now, regarding urine color variations, if your urine appears bright yellow or orange, this usually isn't alarming. Either you're taking B vitamins or certain medications, or you're slightly dehydrated and need more fluids. However, if your urine appears pink, red, or cola-colored, and this persists for more than 1 day, it can signal blood in the urine, kidney stones, urinary tract infection, or problems with your kidneys or bladder. Regarding foam versus clear, for years, people dismissed foamy urine as insignificant. Modern medical understanding tells us that persistent foam or bubbles that don't disappear after a few minutes can indicate protein leaking from your kidneys. What really matters is persistent foam, along with color changes, frequency changes, and any significant differences from what's normal for your body. Now, we've arrived at the most critical part. What is the single most dangerous type of urine? The worst-case scenario representing a true medical emergency is when your urine appears dark brown, like cola or coffee, especially if accompanied by decreased urination or no urination at all. This is called oliguria or anuria, and I cannot stress enough how serious this is. This typically indicates severe kidney failure, where your kidneys have stopped filtering waste effectively. The dark color comes from concentrated waste products that should have been filtered out, building up to toxic levels in your blood. What causes this? Severe dehydration, overwhelming your kidneys, kidney stones completely blocking urine flow, severe infection damaging kidney tissue, medication toxicity, destroying kidney function, or in certain cases, complete kidney failure requiring immediate dialysis. The dark brown appearance tells us kidney function has dropped to dangerous levels. If you ever notice dark brown urine with decreased urination, do not wait. Do not tell yourself you'll call your doctor tomorrow. Go directly to an emergency room or call your doctor immediately if it's during office hours. I've seen patients who delayed seeking care for dark urine, and by the time they came in, they needed emergency dialysis and faced permanent kidney damage. Don't let that be you. There's another warning sign: cloudy white urine. If you notice consistently cloudy milky urine that looks like diluted milk, with or without a strong odor, this also demands attention. Cloudy urine typically means infection in your urinary tract, kidneys, or bladder. Sometimes this is relatively minor, like a simple bladder infection. However, cloudy urine can also indicate serious kidney infection that can spread to your bloodstream. Kidney infections start out manageable but can become life-threatening if untreated. Cloudy urine can also be a direct sign of kidney disease that's already progressing. Abnormal urine appearance, regardless of color, should never be dismissed as probably just something I ate. Get it checked properly with a thorough examination and likely urine testing and kidney function blood work. Now let me give you 3 powerful strategies to protect your kidney health starting today. These are straightforward habits that, if you commit to them, will dramatically improve your kidney function, energy, and overall well-being. Strategy number 1, hydrate consistently every single day. If you wait until you feel thirsty, your kidneys are already working harder than they should. Your kidneys need steady water flow to function optimally. Simply drinking 8 to 10 glasses of water daily, spacing them throughout the day, makes an enormous difference. Proper hydration helps your kidneys filter waste efficiently, prevents kidney stone formation, and maintains healthy blood pressure. Make consistent hydration non-negotiable every day. Strategy number 2, have your kidney function tested at least once after you reach age 50, even if you feel completely healthy. Current recommendations now suggest annual kidney testing at age 45, and if you have diabetes or high blood pressure, even earlier. Kidney disease is called a silent killer because it typically progresses slowly and silently. You can have significant kidney damage for years without symptoms until kidney function drops below 30%. Here's the empowering part. Early kidney disease is one of the most preventable conditions. A simple blood test measuring creatinine and estimated filtration rate can detect kidney problems years before you feel sick. It's literally kidney protection, not just detection. If your kidney tests are completely normal, you'll repeat them annually. Yes, you need to fast beforehand, but that small inconvenience could literally save your kidneys. Strategy number 3, and this is the most powerful: control your blood pressure and blood sugar every single day. These 2 conditions are like silent assassins attacking your kidney filters 24/7. When you manage these conditions, your kidneys function like a highly efficient filtration system working on your behalf around the clock. Let me tell you what healthy kidneys do. They filter 50 gallons of blood every single day, removing waste while keeping essential nutrients. They regulate fluid balance, preventing swelling and maintaining healthy blood pressure. They produce hormones that control red blood cell production and bone health. They maintain the perfect balance of minerals like sodium, potassium, and calcium. They affect your energy levels, appetite, sleep quality, even mental clarity and mood. When your kidneys are healthy and functioning optimally, you feel good. You have energy. Your blood pressure stays normal. Your bones stay strong. But when your kidneys become damaged, your entire body suffers. You may experience fatigue, swelling in ankles and feet, high blood pressure, bone weakness, anemia, nausea, and eventually complete kidney failure requiring dialysis. How do you protect your kidneys from this damage? First, avoid things that harm them. The biggest culprits are uncontrolled high blood pressure and diabetes. High blood pressure damages the tiny blood vessels in your kidneys. Diabetes causes high blood sugar that literally burns kidney tissue. Both conditions together accelerate kidney destruction. Monitor your blood pressure regularly and keep it below 130/80. Check your blood sugar annually and keep it in the normal range. Now, actively support your kidney health by eating kidney protective foods regularly. The best foods are those that help control blood pressure and blood sugar naturally. Leafy greens like spinach and kale, which are high in potassium and magnesium. Berries, especially blueberries and cranberries, with antioxidants that protect kidney tissue. Fatty fish like salmon and sardines with anti-inflammatory omega-3 oils. Whole grains that help control blood sugar spikes. Include at least 2 servings of these kidney protective foods daily. Limit sodium to less than 2,300 milligrams per day. Where do you find hidden sodium? In processed foods, restaurant meals, canned soups, deli meats, frozen meals, and packaged snacks. Reading labels becomes crucial. The beautiful thing is you're not relying on expensive treatments. You're simply eating real whole foods that humans have eaten for thousands of years, and in doing so, protecting the organs that keep your blood clean and your body balanced. This is true preventive medicine, and you have complete control over it starting with your very next meal. Let me bring this together for you. Taking care of your kidney health and understanding warning signs isn't just about your urinary system. It's about protecting your overall health, quality of life, and potentially your survival. Your kidneys are connected to every other system in your body. When they function well, you feel well. I want you to feel empowered, not frightened. Knowledge is power. And now you have the knowledge to monitor your own health effectively, recognize warning signs early, and take action before small problems become life-threatening ones. Start paying attention today. Every time you use the bathroom, take just a moment to observe. Make it a habit. Your health is your most valuable asset, and you have more control over it than you think. Small, consistent actions compound over time into dramatic results. Don't wait until you need dialysis to start caring about your kidney health. Start now, today, with your very next glass of water and your very next trip to the bathroom. I'm Dr. Sarah Mitchell, and I'm here to give you the information and tools you need to take charge of your health and live your longest, healthiest, most vibrant life possible. If this video has been helpful, please share it with your friends and family members, especially those over 50 who need to hear this information. Thank you for watching, and I'll see you in the next video where we'll continue this journey toward optimal kidney health.